Hi, class. It's Dr. Lindner. We are still on bones and osteology. Let's take a look at fracture, different types of fractures, and how bone repairs itself. So, a fracture is a break in a bone, and there's different types of fractures that occur, but the healing process involves three different phases, which we see here, and it happens in four steps. So, there's the reactive phase, and that's the early acute inflammatory phase. There's the reparative phase, and that includes the formation of first a fibrocartilaginous callus, and then that hardens and becomes a bony callus. And then the third phase is bone remodeling, and bone remodeling is the relationship between the osteoblast and the osteoclasts. So in that first, this would be like phase one, these would be phase two, and this would be phase three, right? That's what's happening. So in the acute stage, you got a hematoma, which is a pooling of blood. And then in the reparative phase, you got a fibrocartilaginous callus that forms first, then that evolves into a bony callus. And then the bone remodeling, which is the relationship between the osteoblast and osteoclast. So the hematoma, remember we in a previous video, we showed how you have the nutrient artery breaking through the diaphysis, and the central canals have arteries and veins, nerves and lymphatics. Well, when it breaks, the blood vessels rupture as well. They're torn and they hemorrhage, and you get this clotting of blood. Okay. And it's painful. You can feel like your heart beating in that area that's fractured. Each time your heart beats, you can feel the pulsing. No different than, hammering the tip of your finger with a hammer. You can feel your heartbeat in your finger. So then we have this fibrocartilaginous callus that starts to form, which is granulation tissue. It's a soft callus, and it forms a few days after the fracture. And you got capillaries that grow in and around that tissue, and there's lots of phagocytic type of activity that's happening in there to clean away the dead debris, the dead tissue. And then the bony callus starts to form, right? The fibrocartilaginous callus will convert to a hard bony callus, and that takes about 3 to 4 weeks after the injury, and it continues for a few months, right? This is why you want to make sure you got vitamin D and your diet is rich in vitamin A and vitamin K and vitamin C. All of those are very, very important nutrients. And then we go into bone remodeling, which is this constant osteoblast, osteoclast, osteoblast, and osteoclast, and it just cleans up and remodels. And the compact bone is laid down to reconstruct all the shaft walls. And this is now stronger than it ever was. There's some research that shows that it's stronger the second time, okay, than it was originally. So you have this acute phase, the reactive phase, that's where the hematoma forms. Then you have the reparative phase, which is here. You get the fibrocartilaginous callus, then a bony callus. And then at the very end, you get the bone remodeling that takes place where the fracture ends up being healed. What are some of the common type of fractures that you may hear of? You may hear of an opened fracture or a compound fracture. That's when the broken ends of the bone actually, penetrates through or breaks through the skin. Okay, that is a open or compound fracture. When it's comminuted, that's when the bone is like crushed. It's splintered and broken into so many different pieces, and the smaller fragments kind of exist between the two fragments that are still whole. That's a comminuted fracture. A green stick, think of what happens if you find a straight stick when you're a little kid. If you find a straight stick and you bend this end down and you bend this end down, it'll break right through the center. But if you have a stick that's a green stick that's like this, and you bend this end this way and bend this end this way, there's flexibility. If anything, maybe it splinters a little bit at the top, but it doesn't break all the way through. That's a green stick fracture where it's still intact at the concave end, but the convex end splinters. Okay. Impacted is when one of the ends of the fractured bone is forcefully driven into the other, and it's like impacted. That's exactly what it is. It's like compressed in, impacted. Um, a Potts fracture. A Potts fracture is specific term that's used to explain a fracture of the distal end of the fibula, so it involves the ankle. And a Colles fracture is specific for the distal end of the radius, where it goes posteriorly. A compression fracture, look at the beautiful shape of this vertebra, but look at this one. Very compressed. If someone has osteopenia or osteoporosis and there's an axial compression, like they slip and fall down the stairs and they land on their tush, that's a compression fracture. Okay. And they need typically for this a vertebroplasty. If you catch it early enough, it's kind of like they put this little device inside, a metal device, and they can crank this open so that the end plates open up, and then they fill this with cement, like calcium salts, to make this, to build it up and to stabilize it. This is a spiral fracture. It just kind of looks like spiral. An epiphyseal fracture is when there's displacement, when the bones haven't, when the epiphyseal plate is still open, like in children. If you happen to think of like a mom and a dad that may be holding their child, one with one hand, one with the other, and they're walking with the child in the middle, and they lift up the child by their wrist and they swing that child, right? The parents are swinging the child, but they're holding them by their wrist and their forearm. Because this has not calcified yet, you can get a slippage there. Those are called epiphyseal fractures, very, very common. Guess when? The first day of school. Very common. Why? Because that kid going into kindergarten, they lift them up by both wrists to get them on top of that first big bus step. Okay. Here's comminuted. We have all those fractures.